And we wanted to just mention, and I think Susan's going to talk about this a little bit in more detail, but for those of you who attended the conference last year, we know we talked about it being a very powerful networking opportunity. And this 3-part series is a great example of what can come out of the conference and opportunities for people to just talk together about common issues. So with that, I put in my plug for the conference, which registration is going live tomorrow, and would love to see all of you with us in Roanoke in May. And I'm going to turn it over to Susan Hallett, who's going to be our moderator for today's session.
Welcome, everybody. It's so good to see so many familiar faces and some new friends on the call today. I think we have a really rich agenda for you. Before we dive in, I just wanted to give a little bit of context for how we got here. And I will actually first take a step back and introduce myself. I am Susan Hallett. I am Director of Philanthropy for the Bob and Anna Lou Shaberg Foundation, which is a private family foundation serving the Richmond region. And I will tell you, just by way of introduction, how the Shaberg Foundation got connected to this issue area of older adults and aging. The Shaberg Foundation's roots are in affordable housing and homeless services. But in 2019, we began to understand the impact of the intersection between our housing systems, work, and the aging population. And for example, as our community was successfully reducing homelessness year over year, those over the age of 55 was the only demographic group that was growing each year in homelessness. And so we saw a real opportunity to engage in an issue that was hitting our community fast and furiously. And as Patty said, I think many of you were with us at last year's VFN conference, and then just information that was shared at that time. So in 2022, at the inaugural VFN annual meeting, we heard from Dr. Xian, who is with the UVA's Weldon Cooper Center for Public Service. And at the time, Dr. Tsai highlighted the demographic trends shaping Virginia's present and future. I just wanted to ground us in the reality of what we are seeing here around the aging of our community. She shared these 2 slides, which are incredibly powerful. So the first being the Virginia population by age in 1900. So pay special attention to those top few categories. This is how Virginia population by age looks in 2019. And it's a really staggering picture of the growing aging population in the state of Virginia. And we know that the numbers are continuing to trend in this direction across Virginia. There are about 1.4 million seniors, and the share of Virginians who are age 65 and older has increased from 12% to 16%, and that's from 2011 to 2020, and is expected to increase to 18% by 2040. And while elders are living longer, the complexity of needs continues to grow as well. 80% of those 65 or older have at least one chronic condition, 70% have 2 or more, and most seniors who require assistance live in community. Only about 4.5% of older adults nationally live in nursing homes, and another 2% live in assisted living facilities. And we know that equity is at the root of many of these challenges that our elders face, with challenges disproportionately impacting people of color. And so with these challenges come opportunities for the philanthropic sector to respond in the way that we know best, which is with collaborative and innovative solutions. So our discussion today, as Patty said, is just the beginning of a dialogue about aging and older adults, and we're hopeful that many of you will inform this discussion as we move forward. First, we have the opportunity to hear from Robin Stone, who is a noted researcher and leading authority on aging and long-term policy. Robin's going to help us set the context to frame this system, which is really very complex. From there, we're going to hear from Fred Karnes, because this issue cuts across so many other areas, including housing, healthcare, and workforce. Fred has conducted a field scan of work being supported by funders across the Commonwealth, and he's going to share more about his process and highlight some of the key insights from his interviews. And then finally, we are really fortunate to have a panel of 4 funders with us today that have each implemented different solutions, different philanthropic approaches to support the system of care for older adults in their community. So a really robust discussion today. As always, you are encouraged to ask questions. You can go ahead and put them in the chat, and I will be monitoring the chat and make sure we have an opportunity to share questions with each of our presenters, and then hopefully have some time at the end to do additional discussion as well. So let's go ahead and get started. We are so fortunate to have Robin Stone with us today. She is truly an expert, Robin, you can't deny it.
Well, I won't deny it. I've spent my entire career on this issue. And I'm now actually in the population itself. So I am extremely interested in us solving all of these problems. So today I'm going to talk to you about emerging trends in aging and aging services. And I'm going to go through these pretty quickly because I have quite a few slides. A few of them Susan has already detailed. The most important thing, I think, is just to recognize the first thing, which is that we are really talking about a changing face of our population. More and more, we have become extremely heterogeneous, and that's going to be part of Virginia's story. And I think it's really important as we think about the most vulnerable among older adults, that we think about this tremendous diversity, which we celebrate, but we also have to acknowledge that we need to deal with the equity issues that come with this much more diverse population over the next 20 to 30 years. The other point that I wanted to make, which I find just astounding, is this demographic phenomenon. 2/3 of the people in human history who have reached the age of 65 are alive right now. So this is a very recent phenomenon, and it is something that we need to celebrate. But as Susan was saying, we also need to recognize that we need to have investments in this area because this population is really going to be driving a lot of what's going on in many states, including Virginia, over the next 20 to 30 years. The population in general in the United States is growing. And if you look at the 2010 to 2050, you can see where that growth is going to be. And it is in the 65 and over population in the United States itself. And if you look at the growth in the elderly population between 2000 and 2050, it's really where the baby boomers are starting to turn 65 and then starting to turn 85. It's that growth in the 85 and older population that's really going to be making a significant difference in the needs among this population. If you're 65 to 74, you have a greater chance of actually being fairly well off, at least in terms of mental and physical well-being. By the time you reach 75 and moving into 80 and over, which is where we're seeing tremendous growth in the aging population, this is where the needs really hit. And it's something that I think all foundations in particular need to be recognizing if they're going to be looking at this population, that there are different needs depending on the different types, the different categories of age. A 65 to 74-year-old is not the same as a 75 to 85-year-old, and the 85 and over is very different as well. So we have very different needs and very different preferences depending on the age cohort, and it's something that we need to be paying attention to quite a bit. So if I move to the next slide, this is just showing the diversity, racial and ethnic diversity of the older population. The most important thing to look at here is by 2040 and 2030, 2040, 1/3 of our older adult population will be non-white. And that is very different from right now. And on average, it's about 80% are white and 1 in 5 are non-white. That substantial growth in the non-white older adult population means we're going to have a lot more vulnerable older adults and a lot more needs for paying attention to cultural competence, as well as investments in these subpopulations that we don't really know as much about as we know about the overall white population. We've not done as well in understanding the variation in needs among the African American, people of Hispanic origin, Asian American, and other populations that are actually part of the Virginia landscape these days. The other thing that we want to recognize is the increase in disability by age. And so in addition to the fact that we are reaching older ages, we're going to be seeing older ages with more disability. It's one of the reasons that you see so much attention right now to Alzheimer's disease, because as the baby boomers age, by the time they reach 80, they have a 1 in 3 chance of having Alzheimer's disease or some related dementia. And that's a given, because we already have those folks who are aged. I'm 72. I'm already in this age group. We can't do very much about me if I've got Alzheimer's disease, except to actually help with services and supports. We can do a lot of work on prevention and solving the dilemma of getting Alzheimer's, but it's not going to affect the cohort that's already in the baby boomer generation. For that generation of folks, we're going to be needing to pay attention to supports and services to address the needs of people with dementia, living with cognitive impairment, as well as their families. This also shows you the projected lifetime long-term services and supports need for persons turning 65 in 2015. And the most important point here is that 48% of the folks who are turned 65 in 2015 are not projected to need any significant long-term services and supports needs. It's the rest of that population that's not going to need some type of long-term services and supports. So it's not everybody, but it's more than half are going to need some type of support. And if you look at the charts, women are much more likely than men to need long-term services and supports once they turn 65. Major reason for that being that they live longer. So we have fabulous longer longevity than our male counterparts, but with that comes more disability and also the need for more services and support. So this really is a women's issue. I also wanted to highlight what we're talking about here when we look at the long-term care settings where people are going to be receiving services and care, because they're not all in one place. Susan was talking about the very few folks relative to the large population that's living in the community. Very, very small proportion of older adults are in nursing homes or in assisted living. But there is a tremendous need for other types of residential care environments, as well as investments in home care, because everyone for living as long as they're going to live on this earth want to stay in their own homes. And so we need to be able to look at opportunities for supporting aging in community, aging in place, and having residential alternatives for older adults should they need to move to a place where they have more supports and more services to help them out. And right now, we're pretty much in a wasteland between the nursing home, which if you're Medicaid, if you're low income, you might be able to spend down to Medicaid. If you're not on Medicaid and you are low or modest income, you will never be able to afford assisted living. We do not have many other residential alternatives for these folks, and home care is a real stretch. It's extremely expensive. And the Medicaid waiver program, which is the major support in Virginia, is limited. So we really need to be thinking about policies and programs that are going to help to age, for us to age successfully in our community. And those are the kinds of things that I think philanthropy is really good at, and that is looking at models of care and moving us in a more positive direction. The next question here is, who pays for long-term care? And I just wanted to point out that the major payer for these services and supports in the United States is Medicaid, 43%. Medicare pays for post-acute care, which is the care that you get if you leave a hospital and need home health for a short period of time, or you go to a nursing home for a short period of time because you had a broken hip or something like that. It is truly not a long-term services and supports benefit. It is really a post-acute care benefit. So the big public payer in our programs in the United States is the Medicaid program. There's another 7% that is covered by some type of other public dollars like Older Americans Act, veterans, those other kinds of programs. a very, very limited private insurance. It's been 6% for as long as I've been looking at this issue, and that's for over 40 years. That market has not grown. And then there's 17% of this is out of pocket. And by the way, I want to note that this is all formal payment. This doesn't include the billions of dollars that families invest in with their unpaid sweat and labor, their unpaid blood, sweat, and tears, as well as the foregone opportunities that many caregivers have because they have to leave the labor force or they have to cut back on their own work. So there is a lot of money, a lot of unpaid dollars that go into the system that are not captured by these formal dollars. And finally, I want to show you another statistic that I think is really important because we are expecting that by 2050, and you can see by 2030, the line for the caregiver ratio, and that is the percentage of folks who are actually going to be available to care for older adults as family caregivers, is going to be going down substantially from 7.2 in 2010 to 4.1 in 2030 to 2.9 in 2050. What that means for us is we're not going to have family caregivers available in the same way that we have had in the past to actually provide the services and supports when they are needed. That means we need to develop a much more robust formal system that is going to help to support the current family caregivers, and they may have to supplant family care as we start to see more reductions in family caregiving. Reasons are very complicated about why we're seeing these declines, but a lot of it has to do with increased childlessness, increased divorce, which has an effect on the availability of family caregivers. And there are a number of other issues that are making this extremely, we're almost in a dire situation. Not as bad as countries like Japan, which have 30% older adults and almost no caregiver ratio to speak of. It's pretty much at zero. But we really need to think about alternative systems that are going to support our older adults as they need more services. So then if I move to the next slide, and I'm not sure I need to go through this, Susan, because we've already seen the older adult population in Virginia. I do want to point out a couple of things on this slide, and that is by 2030, 1 in 5 Virginians will be 65 and over. And also the older adult population represents almost half of Virginia's population growth between 2010 and 2030. So that means that your state, older adult aging of the population, is a major, major issue for all of you who are in the funder world. Whether you care about older adults or not, this is the population that is affecting the growth in your state. About 7.6% live below the poverty line, but another 7% are living between 100 and 149%. That's 14% of your population, of your older adult population, is living in poverty. And that doesn't even account for folks who go up to the 200% of poverty or a little bit above. So, and that's really the population that is most vulnerable, those folks who are living below 150% of the poverty line. A couple of other things of note, 37.5%, over a third of your older adults living in Virginia live alone. And that is much higher than the national average. So I think thinking about how you support older adults in the community who are living alone is really important. The other is that 1 in 5 live in rural areas, and they tend to be older and poorer than their metropolitan counterparts. So thinking about rural Virginia and investments in rural Virginia is going to be really important. And finally, about 217,000 of your older Virginians are dual eligibles. These are the folks who are on Medicare and Medicaid. These are really some of the poorest of the folks living in Virginia. And if you want to think about target populations, it's this dual eligible population that we really need to be paying a lot of attention to. Let's see, I'm going to move very quickly through. This last one I think is also important for you to see. Already, you have more non-white population than the average, because 76% of your older adult population in Virginia is white. But the biggest group outside of the white population is 16% of your Virginia population is African American. And that is an incredibly important target population for your state. Much larger population of African Americans than is the average in the United States. You also have 5% that are of Asian origin, and about 2.7% that are other, and that includes Hispanics and other groups, including some Native American populations. But the Black African American population is really pretty important and needs to be a focus in Virginia. So with that as a background, I want to really quickly go through some of the emerging policy trends, because these are the things that if you're a funder or you're working in this area, you need to be paying attention to. These are the big ones. Coordinating acute, primary, and chronic and long-term services and supports. We need to think about an integrated system. We can't continue to have this fragmented system where people are getting their services in all different places. Nobody is coordinating it. The funding is not brought together. It's a horror story for your average older adult who's trying to navigate any system. Secondly, this rebalancing of the long-term services and support system towards home and community-based services. That is the future of service delivery in Virginia. It's the future in the United States. We need a robust, strong, efficient home and community-based services. Technology is going to help us with that. I don't think we're going to see robots replacing people any day soon, but I think we need to think about how we grow our home and community-based delivery system and how we support this for people living in the community. This is particularly challenging, by the way, in rural communities, and I think it's a very fertile area for investment. Another area is affordable senior housing and mid-market residential options. So when I say mid-market, I'm really talking about those folks who are above the poverty line, about above 200% of poverty line, who don't qualify for any benefits, but could never afford, if they had to move out of their house, to move into any other type of housing. We need to invest in affordable senior housing. We need to think about this in terms of not just the publicly subsidized investments through housing authorities and tax credits, but also thinking about how we're going to solve this for the mid-market, of which you have quite a few folks among older adults in Virginia. Three other areas that are significant in terms of investment in this area. One is nursing home reform and culture change in residential care. We have to think about how we reform those double-loaded corridors, nursing homes that were built like hospitals in the 1950s and 60s. Everybody wants to be at home, even the folks who can no longer live in their own homes. We need to think about models and how we have payment structures to reimburse and support residential options for folks who can no longer remain in their own homes, including the nursing home, which is not going to go away. Workforce development is key in all of this, and you're going to hear about some examples of those programs. And that includes particularly focused on the front line, your direct care workers who do 60 to 80% of all the care. And then the final emerging policy issue is, how are we going to pay for all of this? We still have tremendous gaps. Medicaid is the major payer for long-term services and supports. If you don't qualify for Medicaid, if you're not low income enough to qualify for Medicaid, you don't really have any options outside of coming out of your own pocket. Nothing is included in the Medicare program, and we really are at a crossroads right now, I think. And there are a number of states that are looking at long-term services and supports financing options. I think it's something that Virginia ought to be exploring, and it may be something that philanthropy could help at least to sort of think about what are options for older Virginians, since I don't believe we're going to be seeing a national program anytime soon. Let me very quickly, because I know I'm short on time, I just want to pay attention to a couple of issues here. I want to focus on the challenges to workforce development, because I think we need to think about what are the recruitment challenges? How do we get a new pipeline of people into the sector that want to work with older adults, that are competent in working with older adults, and that are paid for, that are supported and well reimbursed and compensated for the services that they provide. But I also argue that retention is the biggest answer, because if we can retain high quality staff, we don't have to be recruiting them. So anytime that we talk to a provider who says, I'm looking for a warm body, we say, you know, what is it, penny pound? I forget what the saying is, but, you know, trying to get the cheapest labor because you can't find anybody else at the end of the day is not going to solve your problems. We really need to think about how do we support highly competent quality staff and not just look for warm bodies who are going to be there for a few months and then turn over. Finally, why are states interested in these LTSS reform initiatives? Because of limited growth in the private market, gridlock in policymaking at the federal level, changes in family composition, and the cost of waiting are starting to exceed the cost of taking action. So to end my little talk, and I know I went through this pretty quickly, I want to say a couple of things about federal policy uncertainties. What do we have that's new in Medicare? We have some new pharmacy benefit controls. We have an increase in managed options, an expansion of Medicare Advantage and special needs plans for older adults. In Medicaid, we've seen a lot of ARPA money. The American Rescue Plan money has been an investment in many states, but I want to underscore the fact that a lot of that money is short-term. It has to be spent by 2024. And the real question here is, all the initiatives that got started through ARPA in the state of Virginia, how are we going to sustain them? And it's really the sustainability, thinking about the building of an infrastructure that's going to support these investments for the long term. We have the AAAs and other social service programs. That infrastructure needs to be supported. I believe very strongly that we need to talk about the future of housing policy. That is something that we have spent very little time looking at. Right now, the only asset that most older adults have is their own home. Even lower income people have assets in their own homes, but they can't get access to them because we don't have very many tools except for a reverse annuity mortgage, which has not been a great product. How do we help older adults to age until 90 and 95 years old on fairly constrained resources? Housing is going to be a critical issue here, and we need to look a lot more at what policies are, both at the federal level as well as at the state and local level. And finally, I would say the future of long-term services and supports. Dealing with this uncertainty, demographics is definitely going to increase the demand for our services. So if you are in philanthropy and you are investing in aging, you are in the right place because these demands are going to be here for the foreseeable future. Aging services workforce is going to be an economic driver. The value-based payment and delivery system reform is continuing, so we have to be a part of that. New residential models in the market and both market rate and affordable housing sector need to happen. We need to focus on naturally occurring retirement communities and villages and how they actually are supported in the future. And then partnerships are essential between social and medical care providers and housing developers, with educational institutions, with workforce development entities, with the business community, and finally, the partnerships with philanthropy are going to be critical. So with that, Susan, I'm going to end my little talk and I'm going to turn it over to you.
Thank you so much, Robin. I feel like we could schedule a 6-hour webinar with Robin and probably still have things to talk about. Robin, we have one question before we move on. Mark
Sure.
Constantine asks, have you seen states where philanthropy has organized to address critical issues facing older adults?
Yes, I have. I think and are you asking that question as have they organized in a way that's not just one foundation, but foundations really coming together
In a collective, yeah.
Yeah, I think one of the examples that I would say is California. And that's because of the master plan on aging, which really set out a full blueprint for the entire state. And many of the philanthropic organizations were actually part of that work. And so they came together as a coalition. In fact, we were just meeting with the SCAN Foundation here yesterday at Leading Age. There are quite a few state foundations, local family foundations, local community foundations that have come together in California to work together as a coalition. I've seen that on the one hand, I've seen that in a large state like California. On the opposite side, I've also seen coalitions of foundations who have come together in Vermont to do a lot of work around the older adult population, as well as in Maine, which is a very small state, but it is the oldest state in the country now. It's actually bypassed Florida. And there, the coalition of foundations has been great. I think it's a fantastic model. We can leverage dollars from foundations and leverage public dollars with foundations. But I myself, when I was in the federal government, used our federal dollars to actually leverage a lot of foundation money. We created a lot of the consumer directed programs through that partnership with foundations. And I think more and more we're going to have to see the leveraging of philanthropic dollars with both public dollars as well as private dollars through social investment.
Absolutely. Robin, thank you so much for your time and your expertise.
Very happy. Anytime,
really
you're only a train away.
That's right. Thanks, Robin. All right. If other folks have questions for Robin as we go through our discussion today, throw them in the chat. And if we have time, we'll address them. And if not, we can always share them with Robin via email. But next, we are really thrilled to have Fred Karnas with us. I know most of you know Fred, a consultant with the Richmond Memorial Health Foundation. And Fred is going to share a little bit about his field scan of philanthropy's work across the Commonwealth in the older adults arena. Fred.
Great. Thank you, Susan. And hello, everybody. As has been alluded to, I have spent the last couple of months talking to folks across the state, 23 different funders from all corners of the state who have been engaged in some form of older adult work. And they're all different kinds of foundations, from community foundations to family foundations to trusts and public and private foundations. And they've committed anywhere from $14,000 a year to all the way up to $500,000 a year to specifically to targeted older adult programs. And so later this spring, this scan we're publishing the scan with a lot more detail than I'll give you today, hopefully to give you a sense of what's going on, where some of your partners might be, some things you might learn from other folks. And I think hopefully will either provide some incentive to get engaged in this work or ideas how to expand the work. So the next few minutes, I just want to give you sort of a David Letterman view of the 10 top things I've learned from these scans. They won't be nearly as funny as David's, but they hopefully will be a little more informative maybe. So the first thing was that it's no secret that the growing need of serving older adults exists across the state. Every person I talked to, whether they were doing a lot of work in the area or just dipping their toe in, said it clearly was an issue in their community. It was fighting against a lot of other priorities, but it was something that needed to be addressed. The second thing was that there was a common theme that also threaded through this, and that ties into what Robin said, which was the whole idea of aging in place. Every funder I talked to said their work was targeted to try to make that possible, and recognizing that while everybody may want to age in place, that may not be possible for everyone. And so the other half of that is sort of aging in community. How can you stay in your community, attached to your local grocery store and drugstore and faith congregation without, when you have to move out of your home for some reason, having to move somewhere far away. There are lots of different pathways to this work. It was interesting to hear how different funders had gotten involved in this aging work. Some is just historic. They've been around for a long time and they've been doing this work from the very beginning. Others had donors who were very interested in this work and pressed them to move in that direction. Some were involved in surveys and research of their community that led them to recognize this as an important issue. And others said, the public hospital community health assessments that they were done in their communities were the tools they used to sort of see what the need was. And my favorite, I have to say, was, and I will, the funder that said this will remain anonymous, was we got involved in older adult work because all of our board members are old. So whatever the reason is, there are multiple pathways to getting to the work, and there was no pushback in any of these in terms of funders saying, well, this is not something we ought to be involved in. And this next one really ties into a lot of what Robin was saying. I mean, I think there's a lot that needs to be done. There's no doubt about that. But there's some really good things happening in the state. And the report coming up later in the spring will speak in more detail. But a lot of the funding that's going into older adult work right now is going into programmatic work, which is not unusual in the philanthropic world. Many funders support their local Office of Aging or local area agency on aging. Others like Richmond Memorial Health Foundation and Susan's organization, Bob and Anna Lou Shaberg Foundation, are involved in support of caregiver work. And you'll hear a little bit more about that in a bit. Adult daycare is a common area where there's a lot of funding. The Culpeper Wellness Foundation has a unique partnership that they've developed with a local congregation to provide this service. And there are lots of interesting models on that front. Home repair and adaptation was identified by many either as a place they were investing or a place they felt like they needed to invest. Also an area where there just seems to be a tremendous amount of need. If you're talking about aging in place, it's a key element of allowing that to happen. And there are a number of others, which I'll talk about in the report, but information referral services, nonprofit capacity building. A lot of folks said, we're willing to invest. Our nonprofits in the community just can't handle it right now in terms of their capacity. And then care transition partnerships were another area that I think was important. And I think the other thing that was I learned from all of this was that support for older adult work often cut across a variety of funder priorities. And Susan talked about this a little bit in the opening. That is that a number of funders have programs that serve multiple populations, and older adults are just amongst that population. Housing is a good example. The Community Foundation of Loudoun and Northern Fauquier counties developed workforce housing and was able, in the midst of doing that in their negotiations, to work out a number of units for older adults in that project. Health safety net programs are common. Health conversion foundations obviously are deeply involved in this, but a lot of other foundations were involved in ensuring that folks were getting the kinds of supports they needed across the multiple populations in which older adults were sort of part of. Transportation, another area. Food security, another area where programs weren't necessarily targeted to older adults, but certainly served older adults. And then another area of learning was that financial investments aren't the only way to make a difference. As I said, much of the work that's being done has been around programmatic support, but many funders were involved in a variety of other activities that were having a great impact on older adults in their community. Path Foundation, for example, doing convenings, bringing together senior service collaborative that has a couple dozen providers and others in the community that get together on a regular basis to make sure that they're coordinating their efforts and ensuring that the work that gets done is a full system kind of approach. Coordination is another area. You'll hear in a few minutes from the Community Foundation of New River Valley and the incredible work they're doing with government and local providers, again, to make sure that they're all connected in a way that gets the greatest impact as possible out of the resources that they have. Older adult system enhancement. Susan talked a little bit about the Bob and Anna Lou Shaberg Foundation's work in supporting efforts to help create a community backbone and expand a community backbone in the community. Some groups are involved in research and advocacy, not a lot, but a few. And several funders mentioned that, well, they didn't invest dollars directly in these sort of non-programmatic activities. A lot of their staff were represented the organization in these coordination and convening type activities. Another area which I found very intriguing was there are a number of creative sort of out of the box things that people are doing. One in particular is in the Charlottesville Area Community Foundation and Twice as Nice, which is a local nonprofit, have partnered together with administrative support and resources being developed by the nonprofit. And they put $250,000 into older adult work on an annual basis, a partnership that the partnership just formed, but the groups have been working together off and on in a variety of ways over the years. Or the Virginia Health Foundation's work and sort of entrepreneurial work in developing the Senior Navigator online resources system a few years ago, which is now a statewide entity that's separate from the foundation, but they were very much engaged in bringing them to fruition and ensuring they got off to a good start. And there have been other lessons learned along the way. One of the things in talking with folks was I asked them, what have you learned from the work that you've been doing? And one of these is a theme that both Robin and Susan talked about, which is racial and health equities need to lead. They have to be addressed if we're going to really make a difference in our communities. I talked about how important relationships were with the grantees, with others in the community, and where these collaborations and convenings are critical in being able to extend resources and impact. Engaging those most affected, engaging people with lived experience, older folks, to be part of the conversations that help inform resource allocation. And then community education was mentioned a number of times, that the needs of older adults are often fall behind other priorities. I mean, every community has lots of different priorities, but there's a real sense that we need to help people understand what the implications, the financial implications and others are of essentially ignoring this population. As we talked, and this overlaps with a lot of what Robin said, we talked about what they would do in the future if a funder had new resources. What are the things that are needed in their communities? And there were a lot of common themes. Technology was on the list, oftentimes, not only technology for how older adults can begin to use technology in a better way and understand it, but also how technology can be used to support older adults through the caregivers and others. Again, racial equities, equities in rural and urban services, the need for human service system capacity and coordination. Workforce, as Robin talked about, was an area. It was talked about in two ways, actually. It was talked about in terms of the way Robin talked about it, which was we need to build a workforce, support it, fund it, pay folks the right way and retain folks. But they're also talk about how we provide the opportunities for older adults to gain income through employment opportunities. And the need for advocacy on behalf and with older adults was seen as critical. And then last but not least, I would call it my one big lesson, which was, as I talked to everybody across the state, it was clear that impact was not necessarily tied to the level of financial investment. I saw some funders that were didn't have a lot of resources to put in, but were having a tremendous impact in their community. And it was just exciting to see that could happen. I'd love to see more dollars in a lot of places, but in some places that's just not possible, but there are other ways to have that impact. So let me stop there and pass it on. Just want to thank everybody that participated and anyone who has additional questions or things that they'd like to add to, please let us know. And you will be hearing from us later on in the spring with a lot more information. Thank you.
Fred, thank you so much. I think it's going to be incredibly valuable to this group of folks in the philanthropic community to be able to see what others are working on and see those trends and find ourselves in the scan and find the opportunities that make sense for us. Because I think the lesson today is that this is a complex, detailed system, and there are multiple opportunities for engagement. And to that end, we are so fortunate today to have 4 folks with us to share information about their specific work in the field of older adults and aging. We have Sarah Hashmall, who's program officer with the Morris and Gwendolyn K. Fritz Foundation, Kira Cook, director of strategy with the Williamsburg Health Foundation, Jessica Wergo, chief executive officer of the Community Foundation of New River Valley, and Mark Constantine, president and CEO of the Richmond Memorial Health Foundation. Again, feel free to drop questions in chat, where we'll see if we've got time for questions after each speaker, but if we don't, we can always share questions with them after our session today. Okay, Sarah, you are up.
Great. Thank you so much. Let me just share my screen here. And does this look okay? Okay, perfect. So hello, everyone. My name is Sarah Hashmall. I work at the Morris and Gwendolyn Capritz Foundation, which is focused on improving the lives of the residents of Greater Washington. I work on the health and wellness portfolio at the foundation, and that includes older adult services. And for this presentation, I'm going to narrow in on one type of program that we fund through our work, which is the Senior Village model, which is something Robin mentioned earlier in her presentation. This is really a community-led program to support older adults. So I'm going to dive right in. And I want to first thank Capitol Hill Village, who is one of our grantees, and they shared a slide deck with me that I modified for the presentation today. So they're also a great resource if anybody wants to learn more about villages. And thank you so much to Capitol Hill Village for this slide deck resource that I edited a little bit. So first, what is a village? A village is a network of older adults and their neighbors who support them to age in place if that's what they choose to do, or to remain healthy, engaged, and as independent as possible as they continue to live in their community of choice. These are hyper-local organizations. Many of them are neighborhood-based, some are zip code-based, but they're really place-based. These are volunteer-based organizations as well. Many of them have no staff, and that ranges all the way up to some have a few staff members. They are really run by volunteers, and there isn't necessarily a big designation between the older adults who are members and volunteers. Many older adults who are members of villages also volunteer with the village, and so it's a great opportunity for them to be able to give and support the organization that they are a part of. Generally, members pay a small fee to belong to a village. This varies village to village, and many villages have sliding scales, and I'll talk in the coming slides about what people receive for being a member of the village. And one really important thing that I want you all to remember during this whole presentation is that because villages are member-driven, no two villages are the same. So keep that in mind. Every village is different, because they respond to the needs of their members in their specific neighborhoods or communities. So what is a village? What kind of services might they offer? And again, these are examples. Not every village is going to do these. But some common services are lists of vetted vendors, like contractors for your home or cleaners, things like that. And this really helps prevent fraud and elder abuse. Rides to doctor's office, grocery store visits, transportation. Some villages train their members and train their volunteers in medical note taking, even to help someone navigate once they get to the doctor's office and keep track of everything. That might be kind of complicated when they're going to their medical appointments. Help around the home. This is really with an eye towards safety. So things like fire prevention, fall prevention, home modifications, light repairs. One village says they describe it to their members as anything you might call like an in-law to help you with. That's something that would be appropriate to ask a volunteer to support with. Friendly calls and visits. So social elements of being a village member are a really big benefit, and one of the reasons why many people join villages. The other part of social calls, friendly calls and visits, is that volunteer is also kind of keeping an eye on that older adult and the village member, and then they can elevate if there's any needs, or that older adult also has someone who they can go to when they need something. So it's deeper than just a neighborly relationship. And then other things that are member driven, like book groups, technology, learning, walking clubs, exercise, you name it. I kind of want to say a village has done it. So but then there's also all these intangibles that come out of these concrete services, and I think this is really important. And one thing that I want to say that I meant to say in the earlier slide is these organizations, because they're so volunteer driven, they do so much and cause such an impact with very small budgets. So as we're thinking about scalable programming, Fred is talking about where small investments can make a big impact. Villages or village-like models are a real area where a lot of important outcomes come out of relatively small investments. So some intangibles that come from the village services are really things that help people stay healthy as they age, you know, being connected, not being isolated, finding a sense of purpose, really having individualized solutions for what you need. And I really want to highlight this last bullet about pandemic response. Villages were and continue to be a really important player in COVID response. They were a trusted source of information when we remember things were very scary at the start. There were all these confusing messages, and people knew they could go to their village for trusted information. Two, villages have a whole network of volunteers who are ready to deploy, who know who lives alone, who might be vulnerable, who has special needs, and they could mobilize those volunteers to do a grocery run for Mrs. Jones or check in on Mr. Smith. And so that was really important. And third, villages played a very big role in helping people in their villages and also people who lived around in the neighborhood access vaccines. Many coordinated with their local governments to facilitate vaccine appointment registration for their village members and other older adults within their community. And the villages were able to advocate for the needs of older adults because they knew what they were, because many villages are led by older adults, their members are right there, and these are relatively flat, not so bureaucratic organizations, so they can pivot. That was the pandemic word, but they were really able to pivot very quickly to respond to pandemic needs. Okay, moving on to the next slide. So some consideration for funders. So because villages are neighborhood based, membership may mirror historical and present day patterns of segregation. And many villages are aware of that and are really working on DEI, looking at their internal policies and practices, increasing member knowledge relating to racial equity, incorporating social justice within their programming. And as you think about opportunities where you might be able to plug in as a funder, there's a lot of opportunity to support the growth of BIPOC villages or village-like models and villages that serve low and moderate income older adults. I've also learned about, in my time working with villages, that they really like to work together. They learn a lot from each other. There's rich networks of villages who might be developing joint services or sharing best practices. So if you aren't able or interested in funding individual villages, there's definitely opportunities to support that network to strengthen village services within a larger area. I'm going to skip these next two slides, which is data from Capitol Hill Village that you can take a look at later in the slide deck about what members' experience is like as village members. And this is my email if you have any questions. So thank you all so much.
Sarah, thank you. What a cool model. I was literally messaging Fred to say, where are the villages in our community?
And you can find them on the Village to Village network. Take a look at that website. It's a global network, in fact, and they have a searchable map. And the DC area, Northern Virginia, has many villages, so it's really rich network. And there's also a network called the Washington Area Village Exchange, or WAVE, and that includes all of Virginia, DC, I think Maryland, and so that's another place where you can get a sense of what are the villages around here. And remember, each village is different with what they offer.
Awesome. Thank you so much. That was really, really interesting. In the interest of time, let's move on with our speakers, and then if we've got time for questions at the end, we'll make sure to do that. Our next speaker is Kira Cook. Kira, take it away.
Thanks, Susan. Let's see. Can you all see my screen? Excellent. So thanks, Susan. I'm Kira, and I just want to give you a really quick snapshot of our work in this space. But before I jump in, I want to acknowledge two people very quickly. First, the Williamsburg Health Foundation CEO, Carol Sale, who after leading the foundation for 5 years is about to depart on a retirement journey. So I just wanted to acknowledge Carol and say thank you. And then also our former colleague, Paulette Parker, is on the call, and she conducted prior to her departure research on this population that really informs and has informed and informs our work going forward. She's really our North Star around this work. So even though she's no longer with us and happily retired, we always think about her when we talk about this work. So I just wanted to talk about our aging in place supports, just starting with funding, because that's what most of us do, as Fred pointed out. We work with quasi-government and governmental agencies and nonprofits for the supports listed on this slide. The last grantee is FREE, which is shorthand for the Foundation of Rehabilitative Equipment and Endowment, and they distribute gently used free durable medical equipment to the community. Our annual grant making is roughly $5 million, and about 10% of our annual giving is in the aging population, which we are particularly interested in, is because you may be aware that Williamsburg is known as a retirement destination. So we have a disproportionately large percentage of older adults living in our community. So I wanted to start with that, but I really want to talk about how we use our other forms of capital we as a neutral convener to advance multi-agency systems change and improvement. And so I just wanted to highlight this one instance that we call Access Williamsburg, which is a one-call center for paratransit for older adults. It's actually not funded by us. It's funded by the Virginia Department of Rail and Public Transit, although we do fund Peninsula Agency on Aging and Williamsburg Faith in Action for their transportation work, but we don't fund the other partners. So we were really pleased to be able to convene this multi-organizational partnership that allows transportation providers to collaborate and have a rider call one number, regardless of the nature of the trip. Prior to the institution of this system, the rider would have to be able to figure out not only their eligibility for services, but the eligibility of the ride that they were taking, and whether it was medical or non-medical, and also the destination, its location, and whether it was near fixed route transit. So it was very complex, and sometimes people would be clients of multiple providers and then have to keep track of that. So the group decided to streamline, but didn't really know how to do that. And so they came to us and said, because sometimes they actually had competing priorities, right? And so they really knew that they wanted to do this. They had a vision, a North Star, but they couldn't figure out how to get there. So they came to us in 2015. This has been a really long game for us, but I do want to emphasize that it was grantee-led, although it was facilitated by us, and we did a commission research and also commissioned contractors to develop a framework for the plan. And it launched in 2022, so it was a 7-year process. So when I say it was a long game, I'm not kidding. We did endure, I think, 6 CEOs at Williamsburg Area Transit Authority and 3 CEOs at Williamsburg Faith in Action. So every time there was a change in leadership, we took a pause and got everybody up to speed. But when it did launch, we saw an immediate increase in capacity over the whole system. And more effective use of the system. So instead of someone calling one agency for a ride near and someone else calling another agency for rides that were near each other, it consolidated services and then simultaneously provided a social opportunity, right? So if 2 people were in the same vehicle, it provided that opportunity. So we see, again, more effective use of the system, increased capacity, and we're very, very pleased with that. And also we're now, because there's a single call, we also have better data, right? Because we know how many calls are coming in, how many rides we're able to fulfill, how many we're not, which are peak times, and whether we need to increase capacity during those peak times or work with riders to smooth to other times, particularly when it's a destination or a ride that is flexible. I also want to say that these one-call centers or mobility manager positions, there's another one. Fred, you mentioned the PATH Foundation earlier. The PATH Foundation was a convener in their one-call center in Culpeper. Their model is very different than ours. This one is a broker model where the rider calls a single number, and then the one-call center, Access Williamsburg, assigns the ride to the appropriate provider. The PATH, the one in Culpeper, is a little bit more of all the needed rides are posted, and then the providers pick which ones they want. So it's a slightly different approach. I don't know if anyone is on the call from PATH who can correct me if I'm wrong. But anyway, that's what we've been doing. Again, it's been a long game, 7 years, but we're really pleased that it launched last year, and middle of the year we'll celebrate a year of operations, and we hope to eventually extend this beyond the older adult population, but we felt we had to start with the population that had the most critical need. So with that, I'm going to stop sharing. Done there. Work.
Kira, thank you so much. I mean, I think that you raise a really important point that this is a long game. I mean, this is work that we all, I think, have to be deeply invested in over a significant period of time. And you have to bring the multitude of partners to the table in order to make it impactful. Thank you. All right, our next speaker is Jessica Wergo. Jessica is with the Community Foundation of the New River Valley. Jessica, we'll turn it over to you.
Thanks, everybody. Me share my screen as well with a few slides for everyone. Can you all see that okay? Okay. Well, good afternoon, everybody. It's nice to be here with you and to tell you a little bit about the work we're doing here in the New River Valley. So for those who aren't familiar with our region, we include 4 counties and a city about 25 miles southwest of Roanoke. Most notably, the main campus of Virginia Tech is here in our region. So we have more suburban areas, like where we are right now in Blacksburg, but then also very rural areas of our service, where we have a lot of older adults. And one of the things that Robin mentioned, I thought was real interesting, and looking at the data, you know, here in Virginia, as she noted, 1 in 5 people by 2030 will be 65 years old. Within our region, it will be 1 in 4 people by 2030 will be over 65. And in some parts of our region, 1 in 3 will be over 65 by 2030. So we really need to focus on the various services, housing, and that kind of integrated approach to support our population. So for us, this work started back in 2014. We were part of a large regional planning process with local government and nonprofit partners, looking at priorities and needs in our region overall. And that's where we really started to dig into the data around the aging demographics of our region, but combined with that, things like the average age of our housing stock, for example. So over 50% of the housing in the New River Valley is over 50 years old. So if you think of those kind of split level 70s homes, that's what we have here. And of course, not appropriate for an aging population with mobility issues. So as we thought about housing, we also thought about all of the supports here, services that were needed. And so we at the Community Foundation with many other folks formed this Aging and Community Network. And you can see the core partners here on our screen. There are also many others. It includes healthcare, housing, local government officials, state level officials, all sort of prioritizing that integrated approach and recognizing that all of us have a stake in supporting older adults. So we have done a variety of different projects over the last several years, but I did want to focus in on one particularly interesting project we've done in terms of kind of capacity building for our region. So a few years ago, our partners came together and created an Aging in Place workbook. This is a workbook that folks can complete. It asks questions related to the things that we all should be thinking about as we age, for housing, health, financial needs, transportation, and those sort of social and connectivity things. So folks can go through the workbook and answer questions specific to them. And then there's also resources from across the New River Valley that can help support them in accessing different services or models of the kinds of things they might want to look at. So all sorts of different really good information within that workbook. But we also recognize that just having the workbook as a resource wasn't enough. So we created an interactive workshop for older adults where we would have a facilitator introduce each section of the workbook and provide some information about how we were framing it. Then asked members at the table to just go through and complete the questions as much as they could. And then some time for small group conversation, because we found that folks really wanted to share with one another what they had discovered during their process of planning for aging in place. And so it became a really rich environment for conversation. But we also recognized as we were rolling it out that the primary audience we were hitting were sort of mid to higher income adults. And that we weren't getting to some of the other populations that we needed to, both lower income adults, as well as communities of color. So then we focused on a Train the Trainer series, where we created a guide for how to facilitate these workshops, so that if our team, didn't have the capacity to do it, that we could create a group of trainers in our region that could do it with particular emphasis on populations that we weren't hitting. So we've held some of these Train the Trainer workshops already and have been following up regularly with attendees to see how they are then using that to hold additional workshops for particular client bases they may have, all with the goal of getting this workbook and the process in the hands of more folks. And then finally, we started just last year what we call our Serving Seniors events. And these are where we wanted to bring some of the different resources to the table and create some networking opportunities between service providers and then also between older adults and those service providers. So these are half-day sessions where we might highlight, say, 10 different programs or resources within a particular county through what we call lightning round presentations. So really short presentations about the basics of their program. And then again, a chance in small groups to have a lot of discussion and information sharing so that more folks are aware of what's available and that service providers get the opportunity to talk to one another. This is a model that we use not just for our work with older adults, but we have several of these collaborative networks, as we call them, that focus on different issue areas. And the idea of helping service providers know what's out there so that any client they have can come to that service provider, and maybe that person might not provide that particular service, but they have met someone at one of these events who does, and so they can really make referral much easier. So we are a very small funder. In the aging work, we may give $5,000 to $25,000 in a year focused in this area. So it's pretty small scale. And so we have done some basic funding, and we find that where our funding comes in is that more flexible money that can be used for things like marketing, venues, printing the workbook, stuff that's not necessarily available to some of our partners who have a lot more restrictions on their money. But perhaps more important than that, we recognize, particularly because we're small, that there are other things that we have to offer beyond funding. So the relationships that we have in the community or some of the systems we have internally can really be used to help this work. So we invest, of course, the time of our staff. We also have a lot of relationships as funders with financial planning professionals. So we leverage those relationships to bring expertise in with some of these older adult populations on what they need to be thinking about with their finances. We've been a fiscal agent for grants. We've used our event registration for these things. So we really try to find ways beyond just the funding to be an equal partner at the table with everyone else when it comes to getting an event ready or printing a workbook or printing some name tags for an event. I mean, nothing is off limits for us. The other thing I'll briefly mention is as we talk about this integration of services, this Aging and Community Network is one among several networks that we're a part of, where we're now in the process of pulling them all together under what we call a network of networks, where that's focused on health and well-being. Because many of the issues that this group is addressing, such as transportation or mental and behavioral health, are the same types of things we're seeing at our network focused on early education and our one focused on food assistance, for example. So again, that kind of convening function for us as funders has proven to be really important and has allowed folks, I think, to see how the services that they offer are critically important to different populations, including the aging population. So just provided some information here. Our local area agency on aging hosts all of our materials, including that workbook, our train the trainer materials, and a series of videos if you're interested in that work that we do. And then of course, I'm happy to share more about what we do down here in the New River Valley to anyone who's interested. So thank you all.
Jessica, thank you so much. It's amazing to see the impact that you all have made, and it goes so much far beyond the financial investment. I want to make sure that we have time for our last speaker, but keep putting your questions in the chat, and if we have time to get to them, we absolutely will. Our final panelist is Mark Constantine with Richmond Memorial Health Foundation. And you are on mute, Mark.
I know, people like me best that way. I will try to move quickly through this so that we have more time. I want to start where actually Kira began, in honoring Paulette. Last year when we met in Williamsburg, Edward Jones, the wonderful Edward Jones, suggested that Virginia philanthropy needed to do more around issues of aging. And the contributions that Paulette has made throughout her amazing career needs to be lifted up and honored. So I just want to honor you, Paulette. I also want to say thanks to Patty and Angie for setting the table for such a rich conversation. Your work makes this kind of rich learning possible. And now I'm going to see if I can move my slide. You know who we are, so I won't spend time there. I do want to say something about the Bob and Anna Lou Shaberg Foundation. The spirit of VFN is a spirit of deep collaboration. And I have to tell you, in Richmond, Virginia, working with Susan and Anna Lou Shaberg on this work sort of exemplifies for me how foundations can work together, and the way that Anna Lou and Susan show up and support not only their partners, but work with this foundation. I just want to sort of honor and acknowledge that. Fred alluded to old boards, and the reason boards get into this is because they're old. Our board is young. I'm just wanting everyone to know that Fred was not referring to us. We have really a dream team of 4 incredibly committed trustees who have gotten behind this work. I lift them up because they represent government and the social sector and the health and human services. And so it's sort of the leadership of our board that I think is particularly important to honor. And the 5 partners below have been sort of the bedrock of where Shaberg and RMHF are trying to go. Our narrative, our genesis story, the really wonderful founding CEO of Richmond Memorial Health Foundation, Jeff Cribbs, and the group of trustees at Jeff Work ran a 7-year body of work called the Older Dominion Project. And so I want to honor Jeff's work. During the pandemic, when RMHF trustees agreed to have an emergency response fund, Fred Carness actually lifted up the body of work targeting older adults. And the partners on the right are those that received dollars from RMHF during the pandemic. One of the major issues that surfaced was around direct care workers and compensation and the challenges around that. And so given sort of Fred's expertise and wisdom and the work that we are hearing our partners do, that deeply informed our trustees. But I have to give a tremendous shout out to Kendra Jones. Kendra Jones, who is now our special projects officer, ran a program called Hearts. It was an effort by the foundation to integrate racial equity with arts and creative expression. And in a partnership with Family Lifeline, direct care workers and their narratives and stories were lifted up. It was an extraordinary project, and I think powerfully influenced our trustees and our team and gave us a richer understanding of the women, the Black, brown, and immigrant women who care for older adults, the strength and courage and resilience they bring every day. And it was just, I think, for Kendra's leadership on this was extraordinary, and I want to acknowledge it. During the pandemic, also Fred and Susan Brown Davis held together a table where they brought together the nonprofit providers who work in the older adult space. And so for about 2 years, which has continued, Fred and Susan Hallett are continuing those conversations. We have sort of monthly by monthly conversations with leaders, creating space for us to be in deeper relationship, but also to hear more consistently the challenges and opportunities our partners are facing. And then, of course, everybody knows that. I mean, the pandemic just really lifted up everything that we have talked about, particularly Robin, when you talked about the workforce challenges. So our trustees had data from many, many different sources, and they had a collaborating partner like the Shaberg Foundation that sort of led us to where we are today. RMHF has a body of work now, along with Shaberg, that has 4 sort of priority areas: the coordination of aging services with the City of Richmond and Senior Connections, which is our AAA an income security demonstration effort, which I take a lot of pride in, I think sort of lifting up the women who provide care. Lisa Bender had asked some questions around policy and advocacy, trying some emergent work around that. And then this question that Susan and I spend a lot of time trying to figure out around housing stability and what's the right role for small foundations like ours in our space. On the sort of the first, we really are trying to sort of support a cohesive and connected system of aging services with the City of Richmond and Senior Connections as the bedrock of that. Kudos to the Shaberg Foundation for making a significant investment in Senior Connections to assess the infrastructure needs of our system and to figure out how we can strategically invest in Senior Connections to build their capacity as an anchor institution in an even more enhanced way than they already provide. We are really working hard on a demonstration effort focusing on income security for direct care workers. As you all know better than I do, how we pay the Black and Brown and immigrant women who take care of our older adults is deplorable. I mean, it's just simply deplorable. And as Robin said appropriately in her presentation, it's not only the retention of folks, I mean, it's not only the recruitment, it's the retention of amazing team members. And so the Shaberg Foundation and RMHF have a 3-year demonstration effort where we're focusing on compensation. So we're lifting up wages of workers. We're focusing on transportation support systems, and we're also supporting on credentialing and laddering and community support of direct care workers. One thing I'm really pleased about Leading Age, the national Leading Age, where Robin works, is conducting a 3-year evaluation that we hope can influence both policy and philanthropic investors and direct care workers. This report is on our website. I encourage folks to read it if you have interest. And if you don't read it, but don't tell me you don't want to read it. The other thing that we're doing, building directly off of the work that Fred and Susan Brown Davis and Susan Hallett are doing, we're in conversations with Melissa Andrews of Leading Age Virginia to see how we can build a stronger and more cohesive coalition around Leading Age and other policy organizations with direct care organizations in our region, but also throughout the Commonwealth. And Sari Raskin, I'm going to give a big shout out for you. Thank you for having Melissa be one of the speakers for your upcoming meeting in Northern Virginia. And finally, I think, like I said, the place where we are really struggling, and Robin alluded to this, the housing needs in our region are extraordinary, not only because of the cost of housing and older adults are being sort of facing increased challenges around taxes on their housing, but just basic needs like home repair. The waiting list for the primary organizations, our community that work on home repair is so extensive, and the federal sort of funding sources are slow and not enough. And so Susan and I are sort of beating our heads around how we think about that. And so folks who have sort of brilliant insights into the housing piece, we would really appreciate. A shout out to Fred. I mean, just Fred's work on sort of the toolkit and interviewing philanthropy and sort of preparing for the annual conference in Roanoke. So Fred, thank you so much for sort of the wisdom and the hard work that you are bringing to this. And then one thing that Susan and I did with our foundations did about a month ago, we brought together 25 pretty diverse leaders from out the Richmond region, nonprofit, government, private sector, to begin the conversation about what we want our region to look like in 2040 and what the infrastructure needs to be in place to support older adults. It's going to be a long time conversation. So Susan, you're right. This is the long play. But I think our foundations recognize that we needed to start the conversation so that we could bring more and more voices into it and center it very explicitly into health and racial equity. So Susan, what did I miss that we need to be talking about?
No, I think that was very comprehensive.
So a couple of last shout outs if I can. To Scott Blackwell, thank you so much for being a co-chair or a tri-chair of the upcoming annual meeting. It means a lot. And we're just really grateful for your leadership.
All right. Thank you to our 4 panelists. We do have a couple of minutes, and I do want to make sure we have an opportunity for questions. There is one in the chat, so we'll share that to kick us off. So it's from Paulette Parker. What are innovations to help optimize the existing geriatric healthcare workforce? Just a softball question to start us off. Does anybody want to tackle that one?
I can jump in briefly.
Thanks, Sarah.
Yeah, you're welcome. And these are strategies that I've learned about through presentations by Grantmakers in Aging, which is a really great resource if any of you all are looking to learn more about this. And a lot of it, I think, kind of builds on what Mark was talking about, thinking about high quality pay, career ladder opportunities, room for advancement, and then also some interesting pilot programs I've heard about happening nationally regarding engaging younger people in their education to introduce them to this as a career. But again, you have to have the opportunities for advancement and fair pay for it to be appealing as a career for more folks. So those are some of the strategies that I have heard about. And Grantmakers in Aging is another great resource for ideas in that regard.
Thanks, Sarah. And Paulette, I'll just say that we, Mark shared a little bit about the demonstration project that we're working on with 2 local organizations in the Richmond community around elevating the direct care workforce. So all of the things that we've been talking about, increased wages, transportation access, career laddering, and opportunities for advancement, but also really working on how do we change the narrative around this workforce and elevating this workforce as, really critical to our community's overall health and well-being. And I think that was so incredibly evident in the pandemic when we had to fight to get direct care workers included in the definition of emergency personnel, or it's just it's actually, thank you, essential personnel. So just a really interesting dynamic. Other questions? Okay, well, we are close to the end of our time, but before we let you go, I just want to say thank you to everyone who participated in this really robust conversation. I think, as you can see, we really just scratched the surface of this very complex and rich issue, and that there is tremendous opportunity for us to continue to talk and continue to explore innovative and collaborative solutions. So we will have that opportunity. This is the first of at least 2 webinars that we are working on for 2023. And in addition, it's been mentioned, but we are working on a session for the May VFN conference with our colleagues at the Williamsburg Health Foundation, Centera, and the Bedford Community Health Foundation. If you have ideas or would like to engage further in planning some of this work, we welcome your input. Please don't hesitate to reach out to me or Mark or Fred or Patty. We would be anxious to include you in the discussion. I think there's so much opportunity for learning and collaboration here. So thank you all. Patty, I'm going to turn it over to you for last thoughts.
Okay, thank you, Susan. Thank you. This was, oh gosh, with an aging parent who we just moved into an assisted living facility earlier this year. It just resonated, and thankful we were able to place her in such a facility and not have to worry about some of the issues that other people are dealing with. And again, thank you so much for being with us today. We really, really just appreciate the hard work that Susan and Fred and everybody have done in lifting up this critical issue.